conditions?
Well, you may have missed the portion of my remarks where I said there is no serious plan being considered by the Republican Congress that would allow discrimination based on pre-existing conditions. That's not a serious proposal being considered. But I'm sorry, I was working on your question, which is those who are on Medicaid now, who may not be on Medicaid following our repeal and replace legislation. Our goal is to give those folks health savings accounts, potentially refundable tax credits, so that they make their own decisions about health care rather than being stuck in a Medicaid system that is failing.
But the president has been really insistent on the fact that everybody in the United States is going to be insured. So is this just an alternative insurance method, or is this actually saying, there might be some people who don't get insurance in the Republican version of the plan?
Well, I would refer you to Secretary Price's comments during his confirmation hearings, where he said that our organizing principle will be access to health care coverage for all Americans. That's the goal. That doesn't mean everybody's on Medicaid. The real goal of Obamacare was Medicaid for all. And that is in a death spiral. That hasn't worked. So we're going to try something that will work.
But moving away from
can't afford it.
More people are covered now.
Yeah, but a focus on coverage is illusory if those people can't be seen by a doctor. These people who are covered, in many cases, have to wait weeks, months for acute care that they need, because providers are leaving the market as a consequence of reduced reimbursement rates.
Right, reimbursement rates. Why doesn't the government or the state of Florida increase reimbursement rates?
Well, you look at California, where they did expand Medicaid, and now a third of the state of California is on Medicaid. They can't raise taxes fast enough to be able to provide for adequate reimbursement rates with that much of their population on Medicaid. So what they had to do was do a 10% across the board cut to reimbursement rates. The consequence of that were providers leaving the system, and ultimately people not being able to go see a doctor.
Are you holding a town hall this week?
Yeah, tomorrow. Open Gaetz Day. Hope you come.
So I think
there'll be barbecue and pizza.
I think the thing that is confusing about it is that I understand you guys are taking issue with this idea of Medicaid. We don't want everyone to be on government Medicaid, fine. But in this access version, does it imply that people are still going to have health insurance, or is there going to be a drop-off? And are you guys comfortable with the drop-off?
Again, I think we're trying to reposition the discussion from one about coverage, which may not actually lead to health care. Instead, we're focusing on the cost drivers of care, and if we give people refundable tax credits, access to more utilization of health savings accounts, then that will reinvigorate a marketplace that has been destroyed. Mary Ellen asked the question, well, is there a marketplace that exists today where someone could take a tax credit and go apply that and get real health insurance coverage? And the answer is today, no. And the reason that's the case is because Obamacare did great violence to the private health insurance market. And so the only way to reinvigorate that market and ensure there's stability so that health care coverage will lead to actual health care is to put the individual in charge rather than having Washington, D.C. in charge.
If you want to push for access to everything, you said your goal here is to increase access to care, not necessarily coverage. So isn't it also the same as saying that if access is not affordable, how is that the equivalent of providing real access?
Sure. Well, that's been one of the great lies of Obamacare, this notion that you'd have affordable health care. The truth is, with rising premiums, with deductibles that are astronomically high, this coverage is truly illusory. I mean, what would Floridians rather have? A card that says you have health care coverage that is functionally useless, or the actual ability to go see a doctor and get better? We want to provide them the latter.
But if you can't afford it, isn't access illusory?
Well, look, we can't afford it now because of Obamacare. Once we repeal Obamacare and provide tax credits, provide expanded utilization of health savings accounts, our expectation is the market will respond. The speaker gave a great example in the education space, where in places where vouchers have been utilized, you've seen a better educational outcome as a consequence.
Two follow-ups. You said you want the right people covered. Could you help me explain to me who are the right people? When you say right
people who are in need, Gary.
Well, what does that mean? What does that mean?
The disabled, children, seniors, people who are truly impoverished. Here's what I don't believe, because I think the root of your question is who are the wrong people to cover. And I think that it is wrong to overburden a Medicaid system that is intended for the disabled and the vulnerable. People like my mother, who's been in a wheelchair for 31 years. Those folks shouldn't have to deal with a smaller and smaller Medicaid pie because we've put a bunch of able-bodied, childless adults into the Medicaid system.
But we haven't in Florida. Do you?
We haven't. In other parts of the country, they have, and that has led to the death spiral of Obamacare. My criticism is not of the state of Florida. I think we've done the responsible thing. I don't want to see a system permeate across the country that repeats the mistakes that have been made in California, Arkansas, Kentucky.
Can I ask a question, and I apologize if I was late?
I've got to, this will have to be our last one because I've got to go testify in committee.
Okay. If you don't have a problem with how Florida is now, how will Medicaid block grants get, do you want more people in Florida? If you're okay with it now, I guess my question is, what would Medicaid block grants change?
Yeah, well, Medicaid block grants would allow our state to be able to appropriately manage utilization of the Medicaid program. If we were able to have reasonable copays, if we were able to have work requirements for able-bodied childless adults, I think there'd be more of an opportunity to direct Medicaid resources to those who are truly in need, rather than dumping a bunch of people into the Medicaid system that overburdens that system for the vulnerable.
I thought Republicans were opposed to rationed care, because that's what that sounds like to me.
No, that's not ration care at all.
Well, no, if you take out, when you say utilization,
Right, no,
that's,
no.
but
We
that-
end up, Gary, we end up with
You have
ration.
requirements of certain things that you have to cover and have to pay for. So when you say we want to change utilization, that could be interpreted as there are certain services that we don't want to pay for anymore, and so
It's the converse.
ergo ration
Yeah,
care.
no. It's the exact converse. We end up with rationed care when you have socialized medicine. Look at Great Britain, where where you're far more likely to die as a result of prostate cancer because those folks aren't able to get screened and treated fast enough because of rationed care. The greatest examples of rationed care are in the healthcare systems that have embraced socialized medicine. If we direct resources to the people who are truly in need, children, seniors, the disabled, people who are impoverished, then I think you get a higher quality product in healthcare where people can actually go see a doctor, rather than the alternative of Obamacare, where you have illusory healthcare coverage, but you can't actually get the provision of healthcare. I'm sorry, guys. I'm like 1 minute away from this committee starting, and I think this bill's up. So I got to run. Sorry.
Thank you.